This is a very interesting case of a 66-year-old male with previous laminectomy. As you see here, the laminectomy in the mid to upper lumbar spine has caused more instability. Patient had already a spondylolisthesis before this surgery, and as you see, the surgery actually destabilized the spine, and patient has now more spondylolisthesis as well. Scoliosis has significantly gotten worse. Here you see the CT cob angle, which as you see is about 30 degrees. What's important to know that when this is laying down, when patient stands up, this can usually be about 30% worse. So the cob angle in a proper imaging was measured to be around 45 degrees. And this patient was taken to surgery for correction of deformity. As you see, we are dealing with quite significant cob angle. What is not obvious here is patient has as well quite significant osteoporosis, which make differentiation in the OR very difficult. Practically what we did here is first identify the bottom level. Here you see it's practically impossible to get a good view of entire anatomy. Here barely you see L5. Now when I'm adjusting for the L5, practically I'm just looking to see the end plate, and I go back and forth until I find the good view, or I only see the pedicle of the 5 and end plate of the 5, barely pedicle, the end plate of the 4. And here in this view, I put already my first Jamshidi in and get some bone marrow to mix with my biologic. Then we perform OLIF, transcamin OLIF in this level. And by us using neuromonitoring, we are able to enter the camin triangle. That deflection that you see is a sign that we are in the right place, and pay attention to the cob angle that's going to get slowly corrected. Here we then enter the disc, then prepare the end plate, do the discectomy, and then we put a 12 millimeter cage. The cage is put mostly to the opposite side, to the right side, to correct the scoliosis. Obviously these are intraoperative x-rays, so right is right, left is left. And here you see the end result. Now we are adjusting for the next level. And here you see that by adjusting it, here we are starting seeing the pedicle of the 4. And again, we put, in this view, put the Jamshidis in the pedicles of the 4. And then we start doing the discectomy and prepare the end plate and put the cage in L3-4. We have to go lots of back and forth. Practically the C-arms have to do acrobatic to get a proper picture here. And here you see as well the grade 2 listhesis right there. The back of the bone here for the L3 and the back of the bone here for L4. And here we enter the disc base. And again, after proper preparation, we put a cage again completely to the other side to correct. And as you see, look at that, the scoliosis already is getting corrected as well. If you look in this view, you see that when the cage is going in, the foraminal size increases. Now we are going to adjust the films for the next level, and again significant maneuver of the C-arm is needed to do that. Now we put the K-wires in the L3, and then after we adjust now for the end plate of the L2-3 here, we are ready to approach that disc. Here we enter it, and again after preparation we put a cage again to the other side, to the right side, to correct for scoliosis. And I'm sure you remember that we started in the laying down position, about 30-degree scoliosis, which is obviously much worse in the standing up. And here we prepare the end plate, and look at when the cage goes, practically scoliosis is corrected. Now we put the gem sheaths, and in the lateral view, at this point we take the AP machine out. We now get the lateral views. The screws are going in, and now we pass the rod and lock it in place on both sides, and that is the final view. And here's the final view in AP. Most of the scoliosis is corrected. I like to show now actually the postoperative CT. This is a very difficult case because the differentiation of the bone is very minimal. With laminectomy as well, the spinal process is hard to visualize. But here, if you look at this, we have been able to correct most of the scoliosis, even though it's not 100% corrected. We have been able to correct to significant amount the scoliosis. And here are the pictures in the coronal view. And I'm going to, and as well, you remember patient had a grade 2 spondylolisthesis, which is significantly now reduced. The spondylolisthesis is much less pronounced now than when we started. The curve angle I'm going to measure here is, I'm expecting to be significantly less, even not completely corrected. It's about 6 degrees, which is significantly better than what it used to be in previous films here. Now, what's important on the right side, when patient stands up, this goes to about 40-45 degrees, whereas on the left, because of the instrumentation, when patient stands up, this remains. This surgery took us about 1 hour and 50 minutes to perform, and literally this patient went home the next day after the surgery, so just stayed 1 night in the hospital. Thank you.